My dear friends, now I am going to ask Dr. Priyanka, when a patient comes here, Z Clinic, can you tell me the first step what you do?
So once the patient enters, he or she should start filling a form. So there will be certain format, certain questions that the patient has to, answer, just to understand what the patient's history is. So once the patient fills the form, the patient comes to us for a consultation, where the basic questions would be what their profession is like. Does it involve a lot of dust? Or do you involve a lot of traveling? Or are you a frequent traveler? Because the water that they use to take bath changes. How is their working environment? It is full of dust, or it is inside a AC room. Everything we ask them in detail. Then we ask a lot about their medical history. Are they currently under any medications? Have they undergone any previous surgeries? Currently, are they taking any medications, or do they have any allergies for any particular medications, etc.? And then we ask them about their family history to understand what had caused this, hair loss. Because one of the commonest causes is their genetics. So we ask your parents and grandparents, do they have any medical illness? Did they have this, hair loss or baldness in their genetics? And then we also ask them about mainly the allergic reactions. So once all the detailed history is taken, once we understand the patients a little bit, then we start counseling them. We start asking them, why are you doing the procedure? What made you think about doing the procedure now? And how frequent, how early you want the procedure, and why is it? Some people will say as early as possible. So we ask them why you have any wedding coming up, because if there's wedding, some people don't know how long it is going to take for the results to be attained. So they think it is something immediate. So we sit and counsel them. No, it is going to take. You have to minimum give us some 8 to 9 months, to have a decent result. If they're planning for a wedding, they have to tell us prior. Because with a half-shaved head, they can't get married. So they have to tell us prior that if they are planning for a wedding or anything. And then psychologically we'll understand what they are going through. Majority of the patients are under depression because of this hair fall. It's not an easy thing as we, assume. So they talk a lot. So when they talk a lot, we try to understand what their expectations are.
Beautiful. Yeah. Expectation. Sometimes the miracle like God, suddenly you expect everything to come, it's not going to happen,
Correct. Yeah. So we sit and counsel them and make them understand it is a slow process. Yeah. So what maximum, they can expect from us. What is the maximum result we could, give them. And we make them, come to the reality, understand that it is going to take some time. You have to have a lot of patience, and throughout the, that 7-8 months, they have to, follow all the medications, protocols. They have to come for regular visits, every now and then have a consultation with us. So yeah, so we counsel them.
Okay. So all the question you ask, then you do counseling, the reality.
Correct.
Whatever the doubts also.
Correct. Okay. They will have n number of questions. Like we discussed previously, they'll have n number of questions, and everything. Minimum a hair transplant consultation would take 1 to 1.5 hours for us. To understand the patient and to make them understand what is hair transplant, it takes a lot of time.
Okay. Yeah. So thank you very much. This is about the first step. So thank you very much. We'll see what are the investigations you do. Okay, thank you, Dr. Priyanka. Thank you, audience. Thank you very much.